Declining physiotherapy care, a growing concern for NHS patients. A recent survey has revealed a concerning trend in the NHS. Stroke patients and individuals requiring intensive physiotherapy are facing deteriorating care due to insufficient hospital space and equipment. The Chartered Society of Physiotherapists surveyed over 2,000 members, and the findings are alarming. According to the survey, 4 out of 10 NHS physiotherapy staff have either lost or are at risk of losing dedicated rehabilitation areas. Furthermore, 6 in 10 respondents reported that their rooms have been taken over by other clinical teams, often due to funding constraints or a lack of prioritization from management. This situation is particularly detrimental to patients' recovery and well-being. Sarah Hazard, the Society's assistant director, expressed her shock and concern, stating, 5 years after the pandemic, it's shocking that rehabilitation space continues to be sidelined and routinely taken away from physiotherapy teams who are then forced to provide care in corridors. She emphasized the importance of these dedicated spaces for patients' physical and emotional recovery, especially after life-altering events like strokes. The issue extends beyond individual hospitals. The number of people waiting for NHS musculoskeletal care has been steadily rising, reaching 388,076 in August. One NHS physiotherapist working in stroke rehabilitation shared a harrowing experience, describing their team's struggle with inadequate rehabilitation space, which has led to patients falling short of the recommended 3 hours of supervised movement daily. The survey's findings are supported by other physiotherapists. A significant 74% of staff reported a decline in the quality of rehabilitation they could offer, while 57% mentioned reduced access to essential equipment. Moreover, 51% of staff observed increased disability among their patients, and 53% predicted higher readmission rates for those under their care. The impact of these challenges is profound. Many patients with injuries from falls are experiencing heightened anxiety, and the public forum of a busy ward is not an ideal setting for their physical and mental recovery. Andy Fletcher, the chief executive of Muscular Dystrophy UK, described the situation as alarming, reflecting the struggles of individuals with muscle-wasting conditions. Fletcher added, "We know the NHS is under enormous pressure. This isn't just unique to neuromuscular services, it's part of a wider healthcare trend. People living with a muscle-wasting condition need a range of specialist and general healthcare, including physiotherapy. The reduction in these services has created a postcode lottery, leaving many patients without the crucial care and support they need." In response to these concerns, a Department of Health spokesperson acknowledged the importance of physiotherapy in patient recovery and committed to ensuring that NHS staff have the necessary facilities and resources to deliver high-quality rehabilitation care. The spokesperson also highlighted the government's plan to shift care from hospitals to community settings, making rehabilitation services more accessible through neighborhood health centers. However, the question remains, how can the NHS address the immediate challenges and ensure a sustainable solution for the future?